I know several of you were here last time, and a couple of weeks ago we heard from people that are in the coverage gap. But today we will hear from healthcare providers who see the consequences every day of people not being able to access the care they need. What is clear, from Joplin to St. Charles and St. Joe to Cape Girardeau, it is time for the Missouri legislature to do what they were elected to do and to tackle one of the most important issues facing Missourians. It is time for the Missouri legislature to have a real and honest debate. And so today we're going to hear from several different healthcare providers who are going to tell you in their own words about what they see each and every day. We're going to start with Dr. Weisbart, who's a lifelong physician from St. Louis.
All right.
All right, Doc.
All right.
Hi, I'm Dr. Ed Weisbart. I've been practicing family medicine for 33 years, since 1982. I retired in 2010, and now I volunteer my services as a physician for free. I'm here today because I'm sick and tired of filling out death certificates like these before their time. Because our state has not yet expanded Medicaid, 700 times a year, there's a doctor like me and some of these others who has to fill out another death certificate about another patient who died too soon. That's 700 preventable deaths every year. Each one of these 700 people has a spouse, a parent, friends, neighbors. They live next to us in our big cities, our suburbs, our small towns, and our rural areas. They wait on us at the restaurant. They provide our children with daycare. They build our homes and our businesses. They ring us up at the cash register. That's 700 people dying early every year. Think about it. That's 2 more people each and every day. That's somebody's loved one every 12 hours. Today, tomorrow, on your birthday, and even on the holidays, death is working overtime right here in Missouri. These people are going to die early because legislators here are more interested in politics than in human life. You may be wondering, how is it that someone could actually die because of politics? Well, let me tell you how. I see it all the time. Last week, 6 days ago in clinic, I saw a diabetic construction worker who was about to go on dialysis after 10 years of being unable to afford his insulin. We're going to start paying $70,000 this year for his dialysis, but we refused to expand Medicaid and pay just $30 a month for his insulin. He's going to have to leave the workforce soon and join the ranks of the disabled. Because of our legislature's decision to not expand Medicaid, I find myself unable to prevent his full disability and premature death. I volunteer my time, education, and 33 years of experience, but still make almost no difference. What's the point of handing him another prescription for another bottle of insulin that he simply can't afford? I am sick and tired of watching untreated diabetes destroy someone's kidneys. I'm sick and tired of seeing strokes from untreated high blood pressure. I'm sick and tired of watching asthmatics gasping for air, unable to say more than 2 or 3 words at a time because they can't afford their inhalers. Imagine watching someone you love gasping for air like that. It's horrible, and it kills, and it doesn't have to. And then, since we're here, imagine that our elected legislature has chosen to allow this to happen. I am sick and tired of a political system that stops doctors like me and the rest of us from saving patients like that. What do you call someone who decides to let his neighbors die? What do you call them? What do you call a legislature that will turn its back on hardworking Missouri families? What do you call a legislature that argues about whether Missouri can afford to save 700 lives a year? Some people say we can't afford to save these lives. I say to hell with that. Yes, we can. 700 people are paying with their lives already. Some people say nobody actually dies from this, and I say, you don't know what you're talking about. We're here today to deliver these 700 death certificates to those heartless state legislators on the wrong side of history. Please, legislators, file these for us. We're sick and tired of it, and you're apparently not. Let's not sugarcoat this. Some people may call it politics. I call it murder.
Next, we're going to hear from Dola Flake, who is a social worker at the Joplin Community Clinic.
very excited to be here today to advocate for Medicaid expansion. I come here for various reasons, one of them being that me, myself, as a single mother and a full-time graduate student, only work part-time, and I will fall in the gap if Medicaid is not expanded. The other reason that I'm here is that I firsthand witnessed the effects of not expanding Medicaid and having lack of access to health care in our patients. As a social worker, we take a holistic approach to health. And in doing that, we look at all the domains. And what I'm finding is that because we are not covering their physical health, that it's dripping into every part of their lives. Emotionally, they're unable to remain stable for their families. Financially, they're incredibly vulnerable, and some of them in a massive debt because of their hospital bills. Socially, they're not getting out and they're not interacting with their communities anymore because they're sick. What's essentially happening is a breakdown of the family unit, and it has to stop today. We have to keep making moves so that we can move towards that. The argument continues that we cannot afford to pay for Medicaid expansion. I rebuttal with that with we cannot afford to continue to let our families break down. At our clinic, we serve the most vulnerable of the populations. And the majority of them have either diabetes, hypertension, or heart disease. All of these are progressive diseases that require continuous monitoring. They're not getting that without insurance. In addition to that, there are preventative measures that can be taken. They're also not getting that without insurance. So I urge our representatives today to make actions, to begin to take steps to make a change. We cannot compromise the well-being of our family and the quality of lives of Missourians simply because of politics. It's time to reprioritize, and it's time to make a difference. I support Medicaid expansion, and I think we need to move our representatives to do the same.
So next we're going to hear from Sagar Mehta, who's a medical student at Washington University in St. Louis.
Hi, my name is Sagar Mehta. I'm a second-year medical student at Washington St. Louis. And I'm here with my fellow medical students today because we represent a component of the future healthcare professional workforce. And we want to voice how essential it is that we expand Medicaid now. As future physicians, it's our inherent duty to advocate for the care of our future patients. And the first obstacle to that is closing the coverage gap. Many of my classmates and I decided to attend WashU because we wanted the resources and opportunities to become the best physicians we could be, whether that be in primary care or specialty care. We spend countless hours studying every little detail of the human body and all that can go wrong with it. But what purpose does that really serve if we're unable to provide care to a significant portion of our society? Everyone in our community deserves to have basic access to care, and it's imperative that we do everything we can to make that happen. I've also had the privilege of helping to lead our student-run free clinic this past year. And we've served about 300 uninsured patients a year, the vast majority of which are working adults who would likely be eligible for Medicaid were it expanded. The basic idea of the clinic is to catch these patients on their illnesses and treat them before their illnesses deteriorate and they go to the emergency department at a much later stage. We want to help our patients get back to their livelihoods, to their healthy lives, and to contributing to the economy. And I remember one patient I saw at the clinic who was a young clothes designer who was unable to work because of a very severe rash he had. We were able to give him immediate treatment at the time, but we couldn't secure him long-term care. So we know that for every patient we see at the clinic, there are thousands more that are not being seen and are witnessing their health slowly decline under no supervision of care. It's gratifying to help the patients we see, but we know Missouri can do so much better. Medicaid expansion just makes sense for Missourians because it would enable more people to seek adequate care and consistent care when they need it to help them lead a healthier life. Thanks.
Next we're going to hear from Karen Wright, who's a lifelong healthcare provider from Kansas City.
Hi, I'm Karen Wright. I've been a healthcare provider for 40 years. Over the years, I have watched my patients struggle to get access to health care. Often I have seen my coworkers scramble to find ways to get patients into some programs in order to get them assistance. I watched as it got worse with the cuts in Medicaid in Missouri some 10 years earlier. Patients would return to our ER on a regular basis who had no regular physician because they could not afford health insurance and could not qualify for Medicaid. It was the same litany, made too much for Medicaid but had no job with health insurance. These were people who often had low-wage jobs, and unpredictable hours. Since I worked in a hospital, we would hear how these patients would tie up our ERs and our ICUs. We would also hear that they were the reasons that our insurance was going up because of all this uncompensated care. Many of us in healthcare support the right to access to healthcare. We in the trenches see how often preventive care could have changed the outcome for some individuals. We understand how expensive intensive care is and how much it makes good economic sense to help people take care of themselves so they can remain in the community and be productive for their families in hospital. When I look at what is happening in Missouri, I see this as a tension between two philosophies. How do you build your community and at the same time provide a rational, humane, economic approach to health care? The Republican caucus has not come up with any rational, humane alternatives. It is clear that they have a philosophy that has been shown to be reckless and in the long run does nothing to help us build our communities. They are refusing to accept federal assistance for Medicaid expansion, but they're willing to accept federal assistance under the guise that under other instances, and they are refusing Medicaid expansion because they say it will not save us any tax money. The money we receive from the federal government has already been accounted for in the ACA. This leads me to the only conclusion that the Republican philosophy is not only costly to the state, but also against hard-working poor people. There is no organized opposition to this issue besides the Republican caucus. There is economic logic and morality that supports expansion. I think we're at a crossroad. I believe expanding Medicaid will strengthen Missourians and the communities we live in, and this is truly the American way.
Next we'll hear from Dr. Bridget Early, who's a family physician from Ashland.
Good afternoon, everyone. As you said, I'm Bridget Early. I'm a family physician from Boone County, and I have a clinic just down the road in Ashland. And as a physician, I can tell you there are Missourians who are sick, in pain, and who are going to die way too soon because they lack affordable health care. And for the last 2 years, our legislation has missed the opportunity to help these people by failing to expand Medicaid and create access to affordable health care coverage for 300,000 Missourians. And these are hardworking Missourians. They're uninsured and have had to forego needed medical care. These are our parents, our neighbors, good people that the legislature continues to refuse to help. They're the people that grow our food, build our homes, fix our cars, care for our children and our grandparents. They take care of us in so many ways, and yet we aren't taking care of them in this one fundamental way of providing them with health insurance. They are paying taxes, and yet the state isn't helping them out by providing them access to health care through Medicaid expansion. I know a farmer in Callaway County. He's uninsured and he falls in the coverage gap because he doesn't make enough for the federal subsidies for insurance coverage. He hurt his shoulder really bad, he needs surgery, but he can't afford it without Medicaid. He just keeps working the best he can with that messed up arm. He pays his taxes, he's putting food on our tables, and yet he isn't getting what he needs and what the state could and should provide for him by passing Medicaid expansion. There's a woman I know who works in one of our local nursing homes. She provides compassionate care for elderly people. She's got a bad heart condition and a very high blood pressure. She can't afford her medications, and if she drops dead of a stroke, it won't be any surprise. I have another woman who worked for many years as a cook in the public school system in Boone County. Last summer, she developed a whole series of blood clots that went through her heart to her lungs. Now she's got chronic, severe problems with her lung and her heart, and needs all kinds of monitoring of the medication of her heart and lung, as well as other procedures that she doesn't, because she can't work. She tried to go back to work, but she just can't even get out of bed long enough without being too short of breath. So she lost her job, lost her insurance, and she can't get Medicaid. She's basically in a really bad spot right now. She has told me she's thinking about suicide, but she figures she's going to die soon anyway, so what's the point? So what kind of a society are we when we can do something for people like this, where we could have a system that would take care of people, and yet we choose not to. I went into medicine when I was 35 because I'd seen how physicians can help people. And my hope is that these lawmakers that we've elected will recognize that they have the opportunity and the responsibility to make a difference for the people of this state by passing legislation to expand Medicaid and to take care of our people. So on behalf of the people I've seen that need the affordable health care and those who are denied, I urge the Missouri legislature to have the debate and to close the coverage gap by expanding Medicaid.
Finally, we'll hear from Reverend Artis Taylor, who's the pastor at True Vine Missionary Baptist Church in Kansas City.
Good evening. Good evening. As was stated, I am Artis Taylor. I pastor a church in True Vine in Kansas City. And as a pastor, I have seen members of our own congregation who make too much for Medicaid and not enough for the affordable health care. I have seen members of our congregation who have had to take half a dosage of the medicine that they need, or to skip a day and then take a full dose. I'm here today, and I believe that you're here today because we have received a calling from a higher power. I believe we are here because we care. We care about those who cannot speak for themselves, so we are the voice for the voiceless. We are here today because we care. Because we care about those who cannot stand for themselves. We are here today because those who oppose Medicaid expansion need to hear from us. And we need to be telling them that it's time to put people ahead of politics. Amen. It's time to put the citizens of Missouri ahead of campaign contributions. It's time to put Republican and Democrat aside and work for the good of the citizens of this state who need their help so desperately. Thank you.
So thank you all again for being here. We will continue to push legislators to do their job and have a real debate and come up with the Missouri solution. Again, thank you for being here. All the presenters and speakers are available for individual comment. So have a good day.